On behalf of the Renew Group, Madam President, this extended Ebola outbreak is a disaster. Not just because more than 2,000 people have lost their lives, but also because that number is due second only to that huge 2014 to 16 outbreak in West Africa, and it is still rising. That shows that as an interconnected world, we have so far failed to learn and act on important lessons from the earlier epidemic. Now, it is fantastic that Europe more quickly mobilized more effective humanitarian effort in response, which was 47 million euros. Since the outbreak started last year and spent on healthcare, on infection control, on contact tracing, on support for survivors, and on community engagement. It's great that EU is working with private companies to tackle the problem that it's more profitable to sell headache cures to rich people than to treat rare diseases that mainly kill the poor. It's also great that the scientific and medical partnerships like Horizon 2020 and the Innovative Medicines Initiative means that 236,000 people have been vaccinated with one Ebola vaccine, and we've now heard a second is on the way. And it breaks my heart that Brexit could jeopardize British participation in programs like this. But the scale of this outbreak, like the last, is not down to inadequate humanitarian response. It is because of systematic failures, poor health education that means many local dismisses outbreaks as hoaxes and even attack or sometimes kill healthcare workers. Poor health infrastructure funded by inadequate domestic resources, with millions often lost to tax avoidance or simply destroyed by conflict. A global health workforce crisis that worst in poor countries, fragile states, and conflict zones, and in which rich countries poach health workers from poor countries. I'm pleased, as the Commissioner commented, that the EU's Directorate General for International Cooperation and Development is now investing in tackling some of the issues. But Europe needs to lead the world to do much more. European humanitarian aid is right and necessary, but if we're not to respond to yet more deaths, it's in a few years' time. We must also invest in public health, in health infrastructure, in local forces, in domestic resources, and in peace.